Hello, everybody out there. I'm Lisa Ferris, the Apprenticeship and Careers Manager at Gloucestershire Hospitals, and this is the third podcast that I am launching in National Apprenticeship Week. So I'm joined today by Ella, and Ella was an apprentice a few years back that came to join us, and Ella's going to share with us her story of her apprenticeship journey and also her background, because Ella has kindly opened up about her story as she was in the care system with us. So a very warm welcome to you today, Ella, and really thanks for joining me. We've met a few times, I know, and got to know each other, but perhaps you'd like to introduce yourself and explain what you're currently doing at the organisation with us.
Hiya, so my name's Ella. I am a student nursing associate at the moment, so I'm working towards my foundation degree. It's an absolutely amazing course, personally. It's definitely a way to be able to study towards that degree, but also still earn at the same time. And it gives you that little bit of a stepping stone between being a healthcare assistant, which I was previously, to be able to work myself up to be a nurse. It's a very good way of being able to get there. That I would agree with.
Sounds great. So you do that at the hospital, and it's an apprenticeship route, and you spend some days at a university, or?
Yeah, so I do 37 and a half hours a week contracted. So I do 2 long days, a half day at the hospital, and then I do a university day once a week. And then we have like summer breaks from uni, Christmas breaks from uni, but we have a lot of practical things, which I think for someone like myself, I learn very practically. If I'm writing about the theory about it, it goes straight over my head. So it's a very practical way of learning, which gives you personally a much wider range of experience within the healthcare system as well.
Great, okay. And are you on like a ward, a medical surgical ward, or?
Yeah, so I'm in Cheltenham General Hospital. I'm on ACUC, which is acute medicine and emergency stroke. So I get to see literally everything, all the way from slightly younger individuals to that end of life kind of individual. I get a full range of everything. It's definitely an amazing experience.
Yeah, that sounds it. So let's kind of work our way back then. So that's really, really good that you're doing that. And it's a 2-year course, I believe, isn't it?
Yeah.
So before that, let's take you back quite a few years of how you first entered the hospital environment.
So when I was 16, I was the COVID year for school. So we finished our secondary school in March of 2020. And I knew I wanted to go in some form of health and social care, but I wasn't really sure where I wanted to go. So I applied for college as like a backup to get in to do my level 2 health and social care. But I also found the healthcare assistant apprenticeship that you guys do within the trust. So you do your 37 and a half hours a week, but you're working alongside. That's a year, I believe, and you get your level 2 in health and social care, which is that was my kind of stepping stone within the trust, and I've been in the trust ever since. It was an amazing course and definitely gave me a lot of the foundations I needed to be able to go on and do the nursing course and the things that I'm doing now. It was a very good stepping stone.
Yeah, so you undertook the level 2 healthcare support worker, which is the qualification we offer subject to availability as and when our needs arise. So you completed that, didn't you? And I think it was probably just, you can do it in around about 15 months at the moment. So we're talking basically about you and your story. And again, it's been really great to know that you can come along today and share your experience, because you entered the care system, and I just wondered whether you could share with our listeners that kind of side of it, because I think it must have been really hard and challenging for you. You've already mentioned about being at school within the COVID, which must have been a challenge within itself, and then coming into a healthcare environment at a young age. But you've stuck at it, so we must have been doing something right. So let's take you back to those younger times, days, and what happened, if you'd like to share.
So there was a slight, I say, different or difficult upbringing in general anyway. When COVID hit, it got a little bit of a struggle for everyone, including myself. There was 7 of us stuck at home for obviously that extended period of time because we were in lockdown. I think everyone just kind of bashed heads because of it being so in that such closed environment that we went into lockdown in the March. I would have been 15, I believe. And then I started the apprenticeship in September, but in that October, it was deemed in the best interest for the household for me to go into supported accommodation and supported living. So it was myself and 3 other young people within that supported house, and it was in Gloucester. It was absolutely lovely company. But it was difficult. You get thrown from your family home to what you know into this house with 4 other people that you've never met before. To then still be able to maintain my weeks at work, to be able to do the coursework on it was difficult. There was a lot of back and forth with home life as well, and there was difficulty within myself with the apprenticeship. I struggled quite hard through it, but we managed to push ourselves through, and we worked our way up. It definitely got easier as times went on and I settled into the care system as such, and I got a little bit more used to being with those 4 young people, with a social worker that comes in overnight. They stay at like 10 o'clock at night till about 6 a.m. and then you're on your own during the day. So it was definitely a big adjustment and it was difficult, but it was definitely doable at the same time. It was just the change.
So you were very, very self-sufficient at quite a young age, as I see it, and you had a lot of changes going on at that time as well, with a new job, apprenticeship. How did you manage to cope? What support? You've mentioned about the social worker and your other people that were in the supported living accommodation, but what other support did you have, and why did you think you could do that? That was another big change.
I have an absolutely amazing partner that I am still with now. He was a lot of help, and there's quite a lot of support within the hospital as well and within the apprenticeships. That some of the people that got in touch with the course and that ran the apprenticeship I was on were absolutely amazing and really helpful. They was able to talk things through with me to be able to find ways of doing things that were still the way they should be done, but that were beneficial to me, and was able to get those reasonable adjustments to adapt from that. Like when I first got put into supported living, there was a week where I was staying with a friend before they found me the placement. And my manager and the apprenticeship team were completely supportive. They let me have that week off so I could just have that week to be able to adjust myself and to adjust my head and to be able to go into my supported before then coming back to the ward, which was absolutely amazing. I think that's what everyone needs at a time like that, is just, right, you've got a week to step away, sort yourself out, and then you can come back to work as such. It's kind of that being able to be open and honest with the management and the support we get from the apprenticeships team to be able to still be able to do your job, but so they understand what's going on as well.
Yeah, I think it is important to be open and honest as much as you can, and you obviously welcomed that support. But a lot of people out there probably within the care community, and I'm not an expert by no means, but I would think they would find it hard to reach out or find that support. What advice would you give to anybody out there that is potentially in the care system or and does want to come into an organisation like this, because they have got a lot of lived by experience? They might be, have dealt with situations that would be really beneficial. So I suppose, is it a case of just really trying to reach out and encourage people to come along, those care leavers out there?
I encourage absolutely everyone to come along and give it a try. If you don't feel comfortable to be able to speak out about an issue or something that you've got going on, that is completely your choice. You don't have to tell someone, but it is helpful.
Yeah.
even if it's someone from the apprenticeship team, or now that I'm at university doing the SNA course, I talk to the university tutors consistently going, please help me with this bit because I'm stuck. Or just asking for that extra opinion or that bit of advice that could help you get through it. But if you don't feel comfortable talking to someone from the apprenticeships team or from the uni, I find it really helpful. I've got an amazing group of friends. I've got an amazing partner. They've been able to help me discuss certain things and work through certain things. And I don't think I would have been able to get to where I am now from where I came from without the support from the people around me, because I've got an amazing circle of friends.
Yeah. Do you feel discriminated in any way when you open up and say, look, I was in the care system? Are you do you get any backlash from anybody or opinions? Or
I've experienced bits and pieces, not so much here. The Trust is a very, very, very inclusive place. It's not into where you're from. It's, well, this is what I'm doing now.
Yeah.
Out in public, there's been some instances where people kind of look at you a bit funny, or if they see you walking with a social worker, you get a few odd looks, to put it politely.
Yeah. But I suppose they don't know the full story, do they? They make those assumptions, and I think as human beings that's quite natural to do. But I suppose that's why today it's really good to hear that you've come on this journey. And I'm sure, perhaps do you keep in touch with a social worker, and does he or she know what you're doing now?
So I have still got a social worker, and he is amazing. I still ring him at least like once every 2 weeks going, I don't quite understand this bit. Can you help me? When you turn 18 in supported living, you get on the Home Seekers, which is basically how to get in touch with a council property so you can get your own accommodation. And he sat with me for days, setting up my gas and electric, setting up my Wi-Fi. I still ring him now going, oh my goodness, I've just passed this, I'm so proud. And he properly cares about it as well, which is nice. So I did my psychology diploma online like last week, and I rung him after, and he started like jumping up and down and shouting down the phone going, well done, you did so well.
Wow.
It's definitely nice to be able to have that support there, even if I am 20 now, so I'm over the age of 18, but I can keep him up until I'm 25 if I want to.
Yeah.
For that extra bit of support, especially while I study, it's been a definitely nice helping hand when realistically a lot of the life skills they don't teach you in school. So like setting up a bank account. In the supported living I was in, there was four of us, and 2 of us had a bank account. So the social workers would help us do that, and they'd help us set up our accounts.
Yeah.
So that way we can let the apprenticeships know, okay, well, this is where my pays go.
So it helped really to get that kickstart really to when you came into the apprenticeship, that you had that bank account and you had those other things that
so they helped me
place.
Set all of that up. So when I started, it was already done, and I didn't have to worry. And that was one thing that I didn't have to stress about with everything else that was going on at the time, and that I'm sure a lot of other people have had situations like that when they get put into some form of, I'm going to say, quote unquote, system, and you don't know how it works. So to be able to have that, to try and set it up already with someone for you, and then when you transfer to something that's a little bit different and you don't understand it, it's already done for you.
Yeah. So just quickly, when you were on the apprenticeship at quite a young age, so 16 we were talking about, and interacting with patients and staff, and having all those challenges still in the back of your mind, but it would seem with me today that you overcame them because you had some support networks around you. Was there any times where you just thought, I can't do this, this is all too much? Or
I query quitting many times. I will be completely honest and say that I was like, I don't know if I can do this, and I bring my partner going, I really don't know if I can get through this. It's difficult. I was never like getting stupidly high grades in school, so the assignments I was struggling with, a lot of the practical work I was struggling with, my partner was no, you're going to get through it, it's going to be fine. And I did, and I managed to do the apprenticeship. I got through it. I passed with a level 2 merit, which shocked me. Didn't think I'd get a level 2 merit, but here we are. And even since starting my SNA course, it's a very hands-on course, and I did my 2-week induction. I turned around to my partner going, I'm going to quit, I can't do it. I'm now a year in, I've passed my first year, and we've been able to push ourselves through that. I think it's just having the confidence in yourself as well that you can do it.
Yeah. Pushing through is a really good way of describing it. You've just got to keep at it, I think, and it is hard, isn't it? But you are really testimony that you can push through things, and you're getting a career for yourself, which is fantastic. So any kind of words of advice for anybody that's potentially listening in the care system, or got challenges at home or within any area of their life that they're thinking about, well, I'd quite like to go and do an apprenticeship, I'd quite like to work in health, but can I do it?
Yeah, it depends on your personal situation, but realistically, you can do it. It's just motivation behind you wanting to get there. If you think in your head, right, I'm going to get this, you will get it, because you will be able to push yourself to be able to work through everything and be able to prove everyone else wrong and go and get it. Because there was a lot of individuals within the setting that I was in that was told all through growing up that they couldn't do it and they wouldn't do it. Yeah. But then that was also a motivation behind them to go, well, yes, I can. Yeah. And you go and prove that people wrong. And to be able to have the motivation and the willpower to be able to go, no, I can do it. Whether you say I can't, that doesn't matter. I will go and do it. And you kind of push yourself through it, get to the end and go, I did that. I did that all on my own, and I did that. Yeah. And it's a very big emotional thing that you managed to get yourself through all of that when everyone said you couldn't, and you did it anyway.
Yeah, very, very good self-satisfaction, isn't it? And it's a shame because the people are listening out there, but they can't see you. I can, and I'm sure it's coming through, hearing that there's constantly a smile or a real positivity about you, and a real genuine smile and positivity. So thank you, Ella, for being so open and honest today. I don't know what else to say, really. Is there anything else that you want to say to anybody out there before we finish today? Because we could go on and on, but you've done amazing on your journey. You're still continuing your journey with us. You did stick through it, through thick and thin. Nothing's easy in life if you want to get it, is it? But all I can say is thank you. And if there's any other parting words, please say so.
I just want to say to literally everyone, I say it when I'm at work, I say it when I'm with my friends, you have to keep positive. I will constantly have a smile on my face, and my friends have nicknamed me the Golden Retriever because I'm constantly bouncing around and smiling. But if that's what you manifest for yourself, that you're happy, bubbly, smiley, I run around like a Muppet, but it helps me and it helps people around me to be able to have that smile. Just stick at it and keep positive, and it will get better. It's a long process, but it does.
Great. Well, that's fantastic. Thank you, Ella, so much for joining me today. It's amazing to see you. I remember seeing you when you first joined, and to see you progress and go on to this journey, it's really, really fantastic. So really well done, and thank you for joining me today.
Thank you for having me.
You're welcome.